tonight we're going to hear from three presenters, Shana, Dr. Emmie Pizarro, and my good friend in Syracuse, Mrs. Oceanna Fair. We'll cover this topic of childhood lead poisoning and drive towards the point of what can families in Utica do to get involved. So at this time, I want to begin by welcoming my colleague, Shana, to begin with her presentation. Shana.
So today we're going to talk about what you need to know about lead. And the first part is a little interactive. So often when I'm out in the community talking to people about lead poisoning, I often hear oh, I didn't know lead was still a problem. So I have a question for the audience. What is a safe amount of lead in your blood? So if you want to come off mute, take a guess.
This is Esther. I don't know the answer. I would just count on the doctors informing us. So I don't know.
Thanks, Esther. That's, at least a very honest answer.
This is Oceanna. There is no safe amount of lead level for your blood.
Correct. The answer is 0, right? But according to the New York State Department of Health, last year they actually changed the level of what they consider childhood lead poisoning. Before it was 10 micrograms of lead per deciliter, and then they lowered it actually to 5, which, is low, but 5 is still enough to cause permanent brain damage. So just looking at some of the stats, in 2017, the national average for children with a blood lead level of under 5 micrograms was about 3%. And then in New York State, excluding New York City, it was slightly lower at 2.8%. Yet, if you look at, for us, Oneida County, the average number of children with a blood lead level greater than 5 micrograms was 11.7%. Or if we want to put those in number, contextualize that, 519 children under the age of 6 have been poisoned. Most of those cases happening in the city of Utica. So why is it happening here? Older homes that were built before 1978 are more likely to have lead paint. And if we look at the chart below, right, you can tell that most, the older the home gets, the higher the likelihood of it containing lead paint. And it kind of breaks it into 3 different categories. So now if you look at the kind of age of housing in Utica, right, you can see that a large majority of homes were built before 1939. So in addition to the old housing stock, we also have concentrated poverty in certain neighborhoods because of years of racist housing policies like redlining and blockbusting, which are being talked about a little bit more often these days as conversations around structural racism is becoming more common. Also, 52% of residents in Utica are renters, right? That's a pretty high population. And again, if they're relying on landlords to keep their properties up to codes, then, it's often an uphill battle. Next, we have a map of the Childhood Lead Poisoning Prevention Program. This map was updated in 2017, but it kind of shows us where the hot spots, right, of lead poisoning happen. A lot of that being in the central kind of midtown area of Cornhill, West Utica and East Utica. You see a few dots in South Utica, but most of South Utica and North Utica homes were built later towards the 60s or beyond. So 70% of all childhood lead poisoning is caused by lead paint dust, right? Often created by opening and closing windows with old lead paint. And, you know, I think about this past summer, it was very hot. And if you don't have air conditioning, or even if you do have air conditioning, right, you put them in the windows. And then what do? You end up blowing that lead dust all over and contaminating more parts of your home or your neighbors. So also, if you look at the bottom picture here of the child, right, windowsills are at the perfect height for toddlers who are learning to walk, and they, you know, pull themselves up and teethe on it, which, you know, also increases their blood lead level. We have a few examples here of chipping and peeling paint, right? Which can happen, you know, inside or outside the home. Again, a lot of that's because of wear and weatherization. Or the picture of the door, right? You can see that the doorknob kind of banged into the wall and created a hole, but if there's lead paint underneath, now it's being exposed and can create more dust. So it's important to really maintain all of the interior if there's damage. But lead also can be found in other places. As some of us know, right, lead can be found in the soil, especially near homes that had lead paint, or roads because of leaded gasoline that was used all the way up until close to the 80s. Lead in water, like we know about Flint, Michigan. But it also can be found in consumer products, and there's a whole long list of possible places to find it, but you know, a lot of imported spices and candies and pottery, toys, jewelry, and cosmetics can contain lead to help with coloring, and you know, some countries aren't as regulated as what they put into their products. And next, I have a kind of a graphic of the ripple effect of how lead poisoning affects not just the individual child and their health, but their, you know, entire future, and the impact that it has on greater society, especially the burden of costs that the taxpayer has to, you know, handle because of increased costs for healthcare, special education services, public safety, and you name it. So finally, I'm just going to remind people to keep it clean, right? Especially in times of COVID and the pandemic, right? It's important to wash your hands, especially before meals, bedtime, and after using the bathroom, right? Make sure you're frequently washing things that go into children's mouths, like pacifiers, bottles, toys, and really make sure to wipe down floors and window wells to capture that lead dust. And also very important to use cold water for making formula and cooking, as hot water can make lead leach out of the pipes more. So I'll stop there for now. And I would like to turn it over to Dr. Emmie Pizarro. She's a local pediatrician at the Slocum Dixon Medical Group. When she's not helping children at work, she can be found in the community advocating for justice and equality or cooking up a gourmet meal. So welcome, Dr. Emmie.
Thank you. Thank you so much. One of my good friends that I usually only see in the streets of Utica when we're protesting something, or no, summer concerts. We dance in the streets too. Good evening, everybody. I'm so happy that you've all joined us. So I just want to see if I can do this technology and share my screen with you. So Shane has covered basically, everything, but I'll focus more on the clinical aspects. Being a pediatrician, I've practiced in Utica since 1995, and I've seen my share of elevated lead levels, but I haven't seen anything as high as what I saw last month. One of my patients came in with a complaint of pica, meaning she's eating non-edible things, and mom said she accidentally walked in on her eating paint chips off of her windowsill. And then when she inspected the rest of the house, she was also eating paint from the doors of her closet. So the lead level at the office that day, we tested her, came back the following day as 124. So I've never seen anything like that. So we called upstate, and she was admitted the same day. And it was even higher when they retested her on admission. So why are children especially more vulnerable to lead poisoning? Okay, so this graphic will show you all of those reasons. First of all, of course, they have immature everything. Their liver, their kidneys, their lungs are not mature yet, so they can't detoxify a lot of the things that go into their system. The nutritional differences, they take in 7 times more water than adults do. So if your lead is in the water, then your exposure is much more. They're smaller in size and weight. So if, let's say, an adult gets a teaspoon of contaminated water, it's not the same as a toddler taking in a teaspoon of contaminated water. They also, of course, have poor cognitive discrimination. They can't discriminate yet what is edible and what's not. So then they tend to be very oral. They explore everything through their mouth. They mouth toys and, window blinds, and if they find crayons or mom's makeup, they'll put that in their mouth too. So of course, curiosity, mimicry, they mimic the older kids with whatever they do. Mobility, we start with crawling, so they're low to the ground. They can inhale and put stuff in their mouth easier. So by 9 months, they start pulling up the stand. By 12 months, they start cruising, holding onto furniture. So until maybe age 3, they're low to the ground, but we're only testing age 1 and 2. And that child that I was telling you about was 5 years old. So we really should be testing more. The other thing is they're helpless. They rely on others for safety and protection, or to escape from, things that contain lead. So again, they're closer to the ground, so they're breathing in more of the dust from the floor. They have an immature immune system, and their brains are still developing. So they have sensitive brain tissue. So I'm going to go to the other childhood differences. Absorption in children can be anywhere from 10% to 90%. Also, if they have nutritional deficiencies, they're more prone to having lead poisoning. Children who are anemic. These slides are from the American Academy of Pediatrics. So Fe is the symbol for iron and calcium and vitamin D, mostly iron deficiencies, but we found that even calcium and vitamin D deficient children are more prone to lead poisoning. Also, it's more distributed. 40 to 50% of children's tissues absorb lead. They also have a very permeable, meaning the lead can cross through the blood-brain barrier. They have deep tissue reservoirs. Their bone is still developing, so the longer they're exposed, the more they absorb lead into their bones, into their tissues. So the target organs for for lead poisoning are the brain, the blood, of course, the bones, the immune system, and the immature kidneys. All right, so factors influencing toxicity. So duration of exposure. The younger the patient is exposed, the longer the exposure, the longer the amount that enters the body. So again, it says iron status increases the risk of blood lead poisoning by 4 times. So that's why you have to check for iron deficiency when you're checking for lead levels as well. I'm not sure about genetics. There might be some role of genetics to play, but definitely more environmental. So how do children present when they have lead poisoning? At the top of the list is headache. They can be irritable because they can't complain. You know, if they're not old enough to say what hurts, they can't complain of a headache, they'll be irritable. They're easily distractible. So if parents complain about, you know, do you think my child should be tested for ADHD? Always think of getting the lead level. They can have vomiting, abdominal pain. If there's a lot of lead chips in the belly, they can be constipated, poor appetite, and they can have trouble sleeping. So this vial shows you that at 10 micrograms per deciliter, even as low as that, you can have decreased IQ level, decreased hearing, decreased growth, impaired peripheral nerve function, like sensory function, and it can cross the placenta even at that level. My first exposure to lead poisoning was during residency. I had my rotation at NYU for hematology. That was my first exposure. It was a pregnant woman who had to be hospitalized because of pica, and she had elevated lead level. So as you can see, as the lead levels rise, there's more and more problems. So by 50, you can have colicky children, you can have frank anemia, you can have kidney failure, you can have encephalopathy. So they could have like decreased level of alertness. They can even go into coma or seizures. And past 140, there's increased risk of death. So that child that I was talking about at lead level of 124 had to be admitted to the critical care unit to be monitored for all of that. Okay, so does lead have a neurotoxic signature? Can we say, oh, these things are the signature symptoms for lead poisoning? There's a lot, it's not a settled science. There's a lot of symptoms that can mimic other problems, like I said, like ADHD or even anxiety disorder. But these are the ones that we have to look out for. Attention problems, executive function, visual spatial skills, behavioral challenges, hearing, speech, and language delays, and fine and gross motor delays. so I won't talk to you about the medical stuff. So lead and behavior. So like I said, if there's any behavior problems or learning disabilities, we have to check for lead. Executive function, like if you tell a child to go wash your face and brush your teeth, and they'll forget everything that you told them. So if there's hearing and speech delays, hyperactivity or aggression, especially in kids who can't talk yet. So aggression, other behavior problems could be signs of lead poisoning. Police reports, school delinquency reports, or school dropouts. Those are some signs to, give you a red flag. So screening, nowadays we test kids who are 1 and 2 years old, but like I said, I think we should test more. We don't do finger sticks anymore. We do a venous blood level. And if any of you listening are in the healthcare field, what we do at our office is because we have the convenience of having a lab in our building, we have the lab technologists go in to the exam room after I examine the child and do the blood draw right there, instead of telling the patients to, here's the lab request, go to the lab and have the test done. So you can capture them while they're there. So which children are more vulnerable? Children in Medicaid, WIC, children who are iron deficient, children who live in homes pre-1978, or have had older homes that have undergone recent renovations, or visit homes or daycares that are, in that stock in the pre-1978 era. Do they have parents or grandparents who have a job or a hobby that involve lead, like smeltering lead into like an artwork? Do they have siblings or playmates that have elevated blood lead levels? Or do they use products from other countries, which is very common in Utica, being an immigrant population? Children in foster care also tend to, because of all the social problems associated with that. Children with autism, because of the cognitive uh, disorder, they don't know what's edible and what's not. They tend to put everything in their mouths. Again, immigrants, refugees, international adoptees need to be tested. So I won't talk about the state-specific compliance. So how do we triage the blood lead level results? If the level is less than 5, we don't do anything. So if they came in at 1 year old and their lead level is 2 or 3, we don't check them again until they're 2 years old. We only repeat lead levels. If it's 5 to 14, we repeat within 1 to 3 months. If it's 15 to 19, we repeat within 4 weeks. If it's 20 to 24, we'll probably repeat within 2 weeks. If it's 25 or more, even closer, and I would refer them to the specialists at a referral hospital. If it's 45, that's a definite admission for chelation. And if it's more than 70, it's a critical care unit admission. So I think I'll stop there, and I'll pass it on to the next speaker, and then I'll just answer the questions when we go into our Q&A section.
So at this time, I'd like to introduce Oceanna Fair. Oceanna was raised on the south side of Syracuse and attended Syracuse City Schools. She's a retired nurse, having worked throughout central New York in hospitals and doctor's offices. And I met her soon after she and her husband purchased their first home on the south side of Syracuse from the land bank that had not properly communicated the presence of lead in their new home. which led to the poisoning of one of her grandchildren. And so from becoming a first-time homeowner, she became a grandmother in search of answers. From there, she became a fierce advocate around preventing childhood lead poisoning in Syracuse. And I'm happy to say she's a South Branch leader of the Syracuse group Families for Lead Freedom Now. So without further ado, Oceanna, I turn it over to you.
Hi, as Paul said, my name is Oceanna. And when my granddaughter became lead poisoned, I was completely taken aback, even being in the healthcare field as a nurse, as Paul pointed out. I primarily worked with adults. So the only time I would ever see lead poisoning is usually if it was job related, and that was out of our specialty. We have a whole unit at Upstate that handles that. So again, that would be a patient that got referred out. So I hadn't had any more experience in my career with lead. However, when I was a child growing up on the south side of Syracuse, my brother became lead poisoned. So we have gone through having a family member treated for lead poisoning, going to Upstate. We spent a lot of time as a young child up at Upstate taking my brother up for treatments. So again, fast forward almost 40 years later, my granddaughter gets lead poisoned on the south side of Syracuse, where we've now bought our home. And this was a problem my family thought Syracuse had solved because we weren't hearing about it. We weren't dealing with it. So although we had some idea of what lead poisoning was, our question became, A, why was it still happening in our community? And B, what was being done to prevent children from becoming lead poisoned? How were they being treated? As I began to look for these answers, I met Paul at a Get Out the Lead event in Syracuse. And our group started pretty much with 3 angry mothers trying to figure out how to get answers for our children and grandchildren, why our children and grandchildren were still being put in these situations. That then grew to a much larger group. And although Syracuse recently passed a lead ordinance that was supposed to start being enforced tomorrow, to be exact, we know that our fight, we're still in the beginning, because although the ordinance is passed, now it's time to make sure it gets enforced. Most of our lead poisoning is in predominantly poor neighborhoods affecting Black and brown children. I was looking at the numbers Shana gave when she said 519 children in Oneida County, and our numbers in Syracuse are almost 1,000 a year. 519 children is one elementary school building in our city. That's how many children an elementary school building in Syracuse holds. So our communities are saying it's okay for an entire school building of children to be poisoned each year. That only infuriated me more when you start looking at that. So that became my fight, was to continue to form this group, give families back a voice, because families weren't being heard. We weren't being heard on prevention. When we were going into doctors' offices here, we're being told your child is lead poisoning and has been lead poisoned. Health department is coming out and saying, you do this and you do that. But nobody is really educating the family as to how this happened, what's being done to prevent it, forcing landlords to fix the problems. As Paul said, I purchased my home from the land bank, which is a city program. They take old homes that have been taken for delinquent taxes. Their whole goal is to put homeowners back into these homes. Yet our home is full of lead. Our granddaughter becomes lead poisoned. And as soon as that closing was done, the land bank left me high and dry to figure out how I was going to get my home remediated. And with the health department, I became enemy number 1. This was now my fault. I needed to figure it out, and I needed to get it fixed. And if not, they continue to have hearings to tell me how much my fines would be. And although we have programs here in Syracuse, yet again, nobody was giving that information to me to say, go to this program, apply for this grant, get your home remediated. That was a lot of legwork I had to do on my own. Then after I did that, we still had a 1.5 years wait until our remediation was done. And if that wasn't bad enough, a county inspector came out, inspected the work, only for the health department to come out 2 weeks later and for the work that the contractor to have done all be chipped up and the lead paint now be re-exposed. Not to mention our soil was contaminated and they left us to deal with that on our own, not giving us any education on how to get that done. So finally, I am happy to say, last week, my home finally passed. We are now lead-free. This fight has been, my granddaughter is 6 now, since she was 4 years old. And so that brings me still now trying to help other families not have to go through all the turmoil that I went through, getting them answers, and even beyond just the basics. When these kids get to school, a lot need IEPs. Their psychological tests need to be done differently than a normal child who would need an IEP. And parents still need advocates in those realms. So that's where our group comes in. That's what we're fighting for. And we're still going to be putting pressure on the city of Syracuse to be enforcing this new lead ordinance that they've passed. So thank you, Shana, for having us.
Thank you. So we set aside some time for questions from the audience. We'd love to answer them on audio, or if you want to drop them into the chat box, and then we can read them out and answer them that way too. You don't all have to jump in at once.
I guess regarding the lead ordinance in Syracuse, I'm just really curious what you thought was the biggest obstacle to getting that passed and getting your city council on board.
Honestly, I feel for us, our biggest obstacle were the landlords. Landlords have a group here that lobbies our common council regularly.
Oh, wow.
Yeah. There's a group in the university area of landlords that lobby the council regularly. Unfortunately, whatever they benefit from, so do the slumlords of Syracuse benefit from. So they were our biggest obstacle, and the council was afraid that if they didn't get the language just right in passing the ordinance, that this group would later sue. Our argument was, though, that Rochester had already successfully passed an ordinance and has been lowering their numbers for some time now. So there was already precedence to show that the ordinance can happen. It was already legally challenged, and it was working.
It's good to know that they really used the precedence of what's going on in Rochester to say, okay, this can be done. That's good. That's good advice. Thank you.
You're welcome.
I would just jump in there and just add, secondary to what Oceanna was talking about, we had a council member, Joe Driscoll, who really wanted to get educated so he could educate everyone else about how the process worked in Rochester. And so legal services worked closely with him to connect him with Rochester. He did a lot of work on his own as well, but we shared information, and I think that education was also very important.
All right, good to know.
This is Esther. I'll jump in. First of all, great presentation, everybody. My question is, I don't know if it's different from county to county or jurisdiction from jurisdiction, or if it's statewide, but I thought that pediatricians tested for lead paint in the blood from the time a child was very young. Is that no longer happening, or is it just spotty?
They're required to get lead tested at age 1 and 2. And if both tests are normal, they're not required to get tested after that unless there's any suspicion. So, and I was just asking our legal people if the parents refuse, but because sometimes they will go, and then if the first try they don't get the blood, they say, oh no, I don't want any more blood tests. I don't want to torture my child. So you can't force them. So, and sometimes they'll say, oh, we've lived in this house forever and we built the house and it wasn't built in 1978. So, but we, legally we can't force them to, but the recommendation is at age 1 and 2.
So do you mean, doctor, that because it's a recommendation, insurance will pay for it? And after
Yes.
that, the
Yes, it's paid for by the insurance. Yes, and then if it's abnormal, the repeat follow-up testing is also covered.
So do you see a problem with that? Do you think that then at age 3, there are kids who are, obviously, I think Oceanna's granddaughter was 4. So is
Yeah.
that something that bears looking at, is trying to get insurance companies to change that policy so that at least it doesn't cost the parent?
I don't think that it will be a problem of insurance coverage. It's the recommendation to test every year. Until what age did you test? So that's what we have to look into, is how, and I'm going to call the American Academy of Pediatrics. How did we arrive at those ages, and should we move them up to 4 or 5? So, but the insurance companies won't have a problem. If I order a lead test on a 5-year-old, they won't have a problem with that. They'll cover it.
So you're particularly attuned to this, but other pediatricians won't order the test after age 2?
No, I would say every pediatrician knows that if there's any developmental delay, attention deficit, any neurological deficit, a pediatrician would include lead testing to that workup.
I think it would be
So-
awesome if they required the testing every year, just because the populations tend to be so transient. So they could be living in a different place at year 2 to year 3 to year 5 and picking up lead poisoning everywhere they go.
Yeah, exactly. Good idea.
So I didn't add this in the original presentation, but now that you ask, here is some data from Oneida County on their kind of testing rates. So, oops, I'm zooming in too much, but essentially, right, you can see a very close correlation between 1 and 2-year-olds being tested over the past, 10 years or so. But even at the highest and most recent, according to this chart, they're only really topping out at around high 60s to 70% of 1 and 2-year-olds. So it's not even 100% of 1 and 2-year-olds.
Right.
And then obviously for kids, or actually 3-year-olds, much lower. And then there's one more chart here that shows the incidence of children in Oneida County with blood lead levels that are higher, or 10 micrograms or higher. So you can see there's a spike back in 2010. It's come down a bit and is eventually working its way down. But that was also before New York State lowered the threshold to 5 micrograms. So it'd be interesting to see kind of what those charts would look like today with that lower level. And also since COVID and, with quarantine and kids spending more time at home, if, they're living in homes with lead, how how much it spiked overall.
I think
Curious
part
if
of the,
anyone had good success getting schools on board, because I feel like if we could get our elementary schools on board, we might be able to get the word out more.
Yeah, I think that we've at least, for Utica, the MLK school district has a clinic that's a community clinic in the school district, and they do point of care testing, follow-up testing for the health department, and then they test all of their pre-K and kindergartners coming into the school, but they are the only ones. So out of the 6 elementary schools, only one of them actually tests kids for lead when they come into an elementary school program. I think Head Start does maybe a little bit better job with that in some cases, but it's not required for daycare either. And you'd think daycare, having kids that are age 1 and 2, that would be something that they might be able to inform parents about, but I don't think they really do.
So I don't think any lead testing takes place in the Syracuse City School District. Carolyn, can you speak to how that got arranged?
Yeah, so Upstate Cerebral Palsy runs the Upstate Health Clinic, and I think Kernan School and MLK have the clinics. The school nurse from MLK was willing to take the point of care testing machine, and because she was willing to do it, and the principal basically said, yes, we'll send the information home to the parents. And a lot of them, for those students, it's not every student that's enrolled in the school, it's every student that's enrolled that goes to that clinic as their primary care physician. But they also offered it to parents that if they wanted to do the testing, so all of the kids that were in the clinic got the testing. The kids that were students but weren't enrolled in the clinic got a choice to opt in for that particular test. So I think they had 80% of the students, they went through, actually the first year we gave them the machine, they tested every student in the elementary school. And now they just test the incoming, so new students, pre-K and kindergarten. But yeah, they had about an 80% of the students when they did the initial testing participated.
Wow, that's incredible. Thank you.
Yep. And our community foundation paid for the lead testing machine, if that helps.
Carolyn, do you know
Melanie,
what
question.
they sample to do the test? Is it a finger stick?
It's the finger stick. So yeah, it's the Magellan Lead Care 2 machine. They do the finger stick. If it comes back as an elevated level,
And they'll
then
do a venous.
they'll do a venous. Yep. But they also do the follow-up stuff for the health department. So instead of the kid or the parent trying to get to a different clinic because they're their primary care clinic, they do the follow-up monitoring for anybody that has an elevated level that's also within the health department.
So I just noticed you said that that's their primary care clinic. The school clinic is their primary care clinic.
Yes, so Upstate Family Medical also has a clinic over on Noyes Street. And then they have the ones that are in the school, the clinic in Kernan and MLK.
So when the school closes, they don't have a primary care?
They can go to the Noyes Street one, which is right
That's
near, yep. Yep, so that's their, technically, I think that's probably their primary clinic, and the school is like their remote location or their satellite location. But yeah, that's the medical agency that runs the clinics in the school.
I think Melanie had something to say.
Yeah, I'm just curious about, I mean, I'm switching topics a little bit, so I wanted to let everyone finish that topic. But I'm curious about how specifically, Oceanna, I see how you got involved, but how do you think we can get other people involved?
there we go. My dog may bark, sorry. She hears something outside. For us, it took a lot of connecting with, usually it's a parent that's in search of answers. And it's trying to connect with those parents and meeting those parents where they are. Whether that's at their school, whether that's at their kids' Pop Warner game, a church event, anywhere where those small children are gathering with their families that you can get their attention for 5 or 10 minutes and talk to them about lead. That's how you're going to get those families involved, because a lot of them have no idea.
Yeah, that's what I was going to ask is, you know, obviously we know that there's families out there, and especially in Utica, that have children with lead poisoning. And yet it seems to be very difficult to find them. And I was wondering, like, as someone who's dealt with it within their family, like, if it's kind of, if there's like a stigma around it, or people are embarrassed to talk about it, and thus don't want to kind of get involved and take action, or I don't know. You know, that's definitely one of the struggles we're having in Utica.
Well, some of the obstacles that I found, like I said, it's my granddaughter who was lead poisoned. And of course, my daughter, her mom is very protective over her and her image. So sometimes you have to be careful. People think that you want to take their child and make their child the face of lead poisoning. You have to be careful with that. You will have some parents who are okay if you need to have an interview with a news station or something, and they're okay with their child being photographed. You're going to have a lot of parents who are not okay with that portion of it. A lot of my angle with parents is telling them that I'm here to help give you your voice back. Tell me what you need. What do you need to get your child healthy, to make sure your family has the support that they need going forward? I know one of our parents went through a horrendous event with a landlord who would show up at her home with people who weren't certified to do the work. This got the police involved. He evicted her. She had to go into a mediation with him. And of course, when she got to the mediation, she showed up by herself. He has a lawyer there, and they're not before a judge. They're before a mediator. Thankfully for her, it came out in her favor, but these things intimidate families. And so for them, instead of fighting with the landlord or seeking out that help, they kind of just back off, withdraw. And so that's kind of where we are, just trying to give them their voice back. So I would start that conversation with those families by asking them, what do you need from me? How can I help you get what you need for your child?
Thank you. Anybody else? Questions, comments?
Yeah, it's Esther again. I guess I want to see if I understood something. Shana, you put up a chart and it looked like you were saying somewhere about around 50% of kids age 1 and 2 were getting tested.
Yeah, I mean, again, I think the data is a couple years old at this point, but I mean, at the highest and most recent, it was topping out at around 70% of 1 and 2 year olds being tested, which, you know, I think is good. I feel like there's definitely room for improvement, though.
And how do we explain that? Why isn't it 100%?
I mean, my guesses, or kind of from what I've heard, is you know, if people are uninsured, or don't have access to, you know, medical care, language barriers, you name it, I feel like they're less inclined to have their kids tested, or, you know, just go in general for their yearly exams, which is when it happens, right? So
And I've also seen parents who refuse because they'll say, "Oh, we just built our house," or I'm sure we don't have lead. They're just adamant that no, not my child. Just like when you tell them you need HPV vaccine, oh no, my child will never have sex. You know, So it's like I I'm not asking for, you know, the moon. I just want to know. But it's like to them, it's a stigma. We don't have that.
Yeah, I think that, I mean, that you kind of touched on it a little bit too. If the lab isn't in the same location as the doctor's office, they may get a script, walk out of the doctor's office and never make it to the lab for the test.
Yes, that's a big one. That's one that we hear a lot from our parents here in Syracuse, is that a lot of them we use, we call them the three major players in our city. We have Upstate's pediatric office. We have another hospital, St. Joe's, who's a huge care provider for underprivileged children. And then we have our Syracuse Community Health Center. And so most of those offices do not draw the children's blood in the office. They give the parents the script. They're sent to another location. And if they've been waiting at a clinic all day with a child who's probably hungry now, hasn't had lunch, is upset, they literally just walk out, don't get the blood drawn. And then the loss of our WIC clinics being able to test for lead was another huge one here in Syracuse. So in WIC, they didn't get those WIC checks until the very end, once they've gone through everything they needed to do, which included their nutrition, consult, their lead testing. So they know they had to get that lead test to get the WIC checks at the end, which they usually need to help put food on the table. And without that factor, we've lost a lot of testing in that area.
Why did that happen? Why did we lose?
Has the head of the health department explained to us here, they had a grant, and I guess that was not either clear in the grant, and Paul may know better than me. So they couldn't do the testing. It went against what the grant was for the testing for them to do. So they do the iron testing, which you're right there, you're already pricking their finger to get the iron. Why can't we just test for the lead also? But now they can't do that. So it's a huge loss for those kids, because they go to WIC right up until they're 6.
So just to add to Esther, from what I've heard, it's not clear why we lost the testing. I've heard several different stories, and so that's why it's not clear. One of the stories is also, I mean, a little different from what Oceanna indicated, that there was a recent audit of the WIC program in Syracuse, and DOH got scared off when the auditors, it was state auditors, told them if they were audited at the federal level, because WIC is an agricultural program, that there would be negative consequences, and so that's one of the stories I've heard as to why they stopped it. But to be honest with you, I really don't know. I don't think anyone outside of the Department of Health knows why it was stopped, unfortunately.
Yeah.
It just seems to me, if there is some way to try to get increased participation and catch this earlier, obviously that's better for everyone. And I wonder, doctor, is once a year enough? Should it be more often, or does it take a long time to accumulate, and really there's no point in doing it more often than once a year?
It depends on what the test result is. So if I check the child at 1 and their level is 1, then it can wait until they're 2. But if they had a level of 4 or 5, then I'll check it again in 6 months.
Yeah, so I had some thoughts when we were talking about, especially the mobile or the testing, is kind of modeling like a mass testing day, kind of like how blood mobiles, go around the community, or even now with COVID, especially with the rapid testing, if we could set up some model that's similar to that. And in some kind of documentaries and videos that I've seen, they have, just a little finger prick machine and have people waiting and just kind of do high volume testing that way. I wonder if that's something we can organize.
When I was younger here in Syracuse, we actually had something called the lead bus. It was a little small school bus. It went all through the city, mostly in the poor neighborhoods. And this is how we discovered my brother had lead poisoning. They came around, you got a little coloring book and crayons, or you got a little small stuffed animal for getting your finger pricked, and they checked it, and then they could follow up. We have mentioned this several times here. We would love to bring the lead bus back, but we keep getting a lot of pushback from our Department of Health here on that.
Yeah, I think Christine and I, was it Minneapolis that you and I walked through the,
Yeah.
I can't remember the name. It had a very cute name.
The
but I can't
Letty
remember.
Eddy van.
The Letty Eddy van.
Yes, it had like this little character painted all around it. It was adorable.
I think, yeah, we need to get a bus. We have created a Facebook page that contains, generic information on, where you can find lead and why it's an issue. And we're looking to, follow in the footsteps of Syracuse's Families for Lead Freedom Now, and really build this grassroots campaign that's inclusive of, the entire community, property owners, teachers, daycare providers, healthcare workers, faith leaders, you name it. So you can find the page at Take the Lead or Take the Lead in Utica. You can send us an email at takethelead.utica@gmail.com. And always you can contact me through work. We're Legal Services of Central New York. We're located at 120 Bleecker Street in Utica, right next to the bus hub. And, call the legal helpline, or you can contact me on my office phone or email with any other questions. Or if you'd like to get involved, again, we're looking to grow our group, and hopefully we'll have more sessions like this in the future. So I know I was definitely moved by our guest speakers' stories and kind of testimony to their work. And I just wanted to thank everybody for attending tonight, and look forward to working with you all in the future.